Nurse Walsh has opinions. That is what Dr. Caldwell said for minutes before Margaret Walsh saved the life he'd already written off. St. Michael's Pediatric ICU smells like antiseptic and fear, fluorescent lights buzz overhead like agitated wasps, and the linoleum floors shine under the glare, worn smooth by decades of families receiving the worst news of their lives. Margaret has been here 3 months, moving through these hallways like a ghost, competent but invisible, the kind of quiet that makes people forget you exist the moment you leave the room. Her locker is austere, fresh scrubs folded in precise military thirds, a pair of worn combat boots leather cracked and faded, laces frayed from 18 years of being carried through places that don't exist on maps. She closes the metal door and catches her reflection in the scratched surface, a woman in her 40s with steady hands and a slight favoring of her left leg, the kind of limp that comes from shrapnel that missed the femoral artery by millimeters. The hospital corridor stretches before her, institutional green walls giving way to the pediatric wing where morning light filters through windows that haven't been cleaned properly in weeks. Margaret checks the fall line on a 7-year-old boy named Jake Mitchell, her hands moving with the terrifying fluid precision of someone who has held dying soldiers while helicopters beat the air around them. The boy lies motionless from the waist down, complete paraplegia from an MVA, motor vehicle accident, 2 days ago, his small frame barely creating a tent under the white hospital blanket. His chart says the spine trauma is devastating, C5 through L2, but his eyes are still alive, still searching the room for someone who might know how to fix him. Then Captain Ryan Mitchell appears in the doorway. Army Ranger dress uniform, chest full of ribbons hanging like medals from a war that never really ends, face carved from the kind of worry that only a father with a broken child can wear. Margaret's hands don't shake when she sees him. Her jaw tightens almost imperceptibly, a micro-expression so subtle that only someone trained to read silence would notice. She continues adjusting Jake's blanket as if Ryan Mitchell is just another parent, not the officer whose femoral artery she clamped in Bagram 8 years ago while mortars shook the aid station and blood pooled on the concrete like spilled coffee. Captain Mitchell, she says quietly, her voice carrying the careful deference of someone used to being underestimated. Jake's vitals have been stable since 0600. No fever, no respiratory compromise. Ryan nods, but his eyes search her face as if looking for something he can't quite name. He's studied her name tag 3 times now, Walsh, but the connection hasn't fired yet. 8 years is a long time. Trauma does that, it burns faces into memory but time erodes the details. Margaret's hair is different, grayer at the temples now. The scar along her left jaw that used to be fresh and angry has faded to a pale line that most people never notice. "Thank you," he says finally. I need him to wake up. I need him to understand what's happening." "He understands more than you think," Margaret replies. She meets his eyes for exactly 2 seconds, long enough to be professional, not long enough to create suspicion. "Children are resilient, sir. More than we give them credit for." Ryan sits in the bedside chair, and Margaret excuses herself to check the morning medications. She moves through the hallway with measured steps, her shoes clicking against tile in a rhythm that sounds like a metronome, like discipline, like someone who learned to walk quietly so the enemy wouldn't know you were coming. Her locker is in the staff room, tucked between a refrigerator that smells like spoiled yogurt and a bulletin board covered in notices about continuing education and HIPAA violations. She opens it and looks at the combat boots, Ryan's boots, though he doesn't know that yet. She'd pulled them from the aid station in Bagram after the evacuation, when the dust was still settling and 16 soldiers were still breathing because she'd refused to accept that Captain Ryan Mitchell was going to die. The boots smelled like diesel and sweat and Afghan soil. She'd kept them all these years as a reminder of the mission, of the weight of secrecy, of the 16 names she still recites on sleepless nights at 3 in the morning when the trauma won't let her rest. The boots are evidence. They're also her greatest liability. Dr. Caldwell arrives for evening rounds at 17 minutes past 4, which is late because punctuality doesn't matter when you're the head of pediatric neurology and you know it. He moves through the ward like a man who owns the place, residents trailing behind him like ducklings following their mother. There are 5 residents today, 4 men and 1 woman, all of them dressed in pristine white coats that still have creases in the sleeves. Caldwell's coat is wrinkled at the hem, stained with coffee near the pocket. He doesn't seem to notice. "Let's see Mitchell," he announces, stopping at Jake's bed without actually looking at the boy. He pulls the chart from the holder and flips through Margaret's notes, the one she's written over 3 days, documented observations about spinal cord swelling, recommendations for early mobilization protocols, suggestions for experimental nerve stimulation therapy that's showing promise in peer-reviewed literature. He doesn't read any of it. Posterior column injury, complete loss of motor and sensory below the lesion, he says to the residents, speaking as if Jake is a cadaver instead of a 7-year-old with eyes that track every word. Prognosis is clear. Surgical intervention at this point would be futile. We manage pain, we prevent infection, and we prepare the family for the reality of permanent disability. This is the standard of care. Margaret stands at the foot of the bed, hands folded, waiting. There's new research on intensive physical therapy combined with neural stimulation, she says quietly. The protocols show 53% improvement in motor recovery over 18 months if initiated within the first 72 hours. Jake is within that window. Caldwell's head swivels toward her with the speed of a predator spotting movement in tall grass. His eyes are pale gray, the color of concrete, and they contain absolutely no recognition of her as a human being. Nurse Walsh has opinions, he says to the residents, his voice carrying the kind of amusement you use when discussing a dog that's learned to perform a trick. Did anyone ask for opinions? No? Good. Because this ward operates on evidence-based medicine, not fairy tales. He turns back to the chart, flipping through Margaret's notes again with his thumb, reading none of them. These extensive notes are unnecessary, he continues. Chart efficiency saves time. Save time, save money, save the hospital from liability. Understand? He looks at Margaret directly now, and his smile is the kind of smile that would look friendly if his eyes weren't completely empty. Or are you planning to write us all dissertations? One of the younger residents, a man who can't be more than 28, still carrying the softness of someone who hasn't learned that medicine is practiced on people you have to pretend are invisible, shifts his weight uncomfortably. The woman resident stares at the ceiling tiles as if they're suddenly fascinating. "I apologize, Doctor," Margaret says. Her voice doesn't waver. "I was attempting to contribute to the patient's care." "Right. Well, stick to what you're trained for, yeah? Vitals, bed baths, that sort of thing. The clinical decisions belong to physicians." He closes the chart with an audible snap. "Now then, does anyone see the obvious diagnosis here? Anyone?" Hands go up. Caldwell points to a resident with dark hair and an expensive watch, the kind of resident who comes from money and knows it. "Go ahead, Martinez." Posterior spinal cord syndrome with complete transection, Martinez offers confidently. Prognosis for recovery is essentially 0. Exactly. This is what medicine looks like, people. Not hope. Not wishes. Not long shots and experimental therapy. Evidence and realism. That's how we build trust with families. Caldwell turns to Ryan, who's been standing motionless in the corner, trying to disappear into the institutional beige paint. "Captain Mitchell, I know this isn't what you want to hear, but your son's spinal cord is severed. He will never walk again. We'll manage his quality of life from here on out, but recovery is not an outcome we should discuss with false hope." Ryan's face doesn't change. He's heard worse news. He's received casualty notifications. He knows how to absorb a hit without flinching. "What about the research?" he asks quietly. "The new protocols?" Caldwell smiles. It's the kind of smile that reaches the mouth but never makes it to the eyes. "There's always research, Captain. There's always hope somewhere if you look hard enough. But in this hospital, we practice medicine based on peer-reviewed evidence from established institutions, not preliminary data from internet journals." He glances at Margaret. No offense to our well-meaning nursing staff who spends her time reading fringe science. Margaret doesn't move. She doesn't respond. She simply stands there with her hands folded and her expression neutral, the kind of neutral that could mean anything or nothing depending on what you're looking for. But her jaw has tightened again, a barely perceptible contraction of muscles that's visible only if you know how to read the language of people trained to hide their responses. Caldwell turns to the residents. "Let me make something clear. This is your ward now. Well, it's my ward technically, but you're going to own it by the end of this rotation. That means you need to learn to filter the noise. Every patient's family will come to you with stories about miracle treatments and experimental therapies and celebrities who beat impossible odds. Your job is to be the adult in the room. To tell them the truth, even when the truth hurts." He glances at Margaret again. "Especially when the truth conflicts with the optimistic fairy tales you'll hear from well-meaning staff members who've been doing this job too long and forgot what real medicine actually is." He starts toward the next patient, residents trailing behind him like ducklings, and one of them, the young one with the uncomfortable shifting, makes eye contact with Margaret for just a moment. His eyes are apologetic. His youth is still showing. Caldwell will wear that out of him within 6 months. Margaret checks Jake's for lines again, even though they don't need checking. Her hands move with the precision of someone who learned first aid in a place where mistakes meant someone died. The boy watches her with the alertness of children who understand that adults are lying to them about how serious things really are. "Is the doctor right?" Jake asks quietly. "Will I never walk again?" Margaret pauses. She counts the beeps of the heart monitor, steady at 87 beats per minute, a child's resting heart rate, normal and pure and full of nothing but the simple electrical impulses of being alive. The doctor has seen many cases, she says carefully. But every spinal cord is different. Every body heals differently. Right now, we focus on what we can control. The physical therapy. The medication. The things that give your body the best chance to heal itself. It's not the answer he wanted. But it's the truth, not the hope-starved fairy tale Caldwell described, but something rarer, honest uncertainty that leaves room for possibility. After the rounds end and the ward settles into the soft chaos of the evening shift, monitors beeping, visitors checking in, medication carts rattling through hallways like metal symphonies, Margaret returns to her locker. She opens the metal door and looks at Ryan's combat boots again. The leather is cracked from desert heat, the laces are frayed, and the soles are worn thin from walking through dust that settled in places that didn't officially exist. 8 years ago, in Bagram, she'd been someone different. Master Chief Petty Officer Margaret Walsh, attached to a combat surgical team, tasked with keeping soldiers alive in a place where death was the default outcome. She'd saved Captain Ryan Mitchell that day, her hand steady as she worked while mortars shook the concrete and the smell of blood mixed with diesel fuel and sweat. And then the NCIS call had come, the one about the suspected theft ring operating out of San Antonio hospitals. The one that needed someone on the inside, someone who could disappear into the system, someone who understood both military culture and medical environments well enough to infiltrate without leaving fingerprints. Someone like a retired Master Chief Petty Officer who could become just another nurse, unremarkable and overlooked. But that wasn't the worst part. The worst part was that Jake Mitchell, the boy lying in bed with those pale, desperate eyes, was the reason she'd been recruited for this assignment in the first place. 3 weeks before his accident, NCIS had flagged a suspicious medical supply order connected to St. Michael's. They needed boots on the ground. They needed someone who could integrate into the pediatric ward without raising suspicion. They needed someone who knew how to survive in impossible situations. They didn't know that the officer whose son had just been paralyzed was the same man whose life Margaret had saved in Bagram. They didn't know that the target of the investigation, the person likely running the theft ring that was funneling prescription medications into the black market, was Dr. Caldwell himself. But Margaret did. Margaret waited until the break room was crowded enough that her presentation wouldn't draw immediate attention. 3 younger nurses, a respiratory therapist, 2 residents rotating through pediatrics. She'd printed the research articles herself at 3 a.m. in her apartment, binding them with hospital staples, her hands moving through the familiar precision of preparation. Studies from Johns Hopkins, Mayo Clinic, the Cleveland Clinic's Pediatric Spine Program. All published within the last 18 months. all showing the same trajectory: early intervention with electrical nerve stimulation protocols in the first 72 hours post-injury could restore significant motor function in children with complete thoracic spinal transection. Jake Mitchell was on day 64. The window was closing. She laid the articles on the break room table next to the coffee maker, not defensive, not tentative. Just laid them there like facts. Research on pediatric spinal trauma, she said quietly to the two nurses closest to her. Early electrical stimulation shows promise. Hayes protocol from Hopkins, 42 pediatric patients, 31 restored partial function. Most dramatic results when intervention begins within 72 hours. She tapped the methodology section. The mechanism is still being mapped, but it appears the electrical current prevents apoptosis of motor neurons during the initial inflammatory cascade. Rather than accepting paralysis as inevitable, we're intervening at the cellular level. One nurse was reading. The other was nodding slowly. That's when Dr. Caldwell walked in. He moved toward the coffee maker with the casual authority of someone who had never been told no in an operating room. His white coat was pristine, creased at the shoulders like he'd had it pressed that morning. He glanced down at the research articles spread across the table the way a man might glance at a child's finger painting. Then he picked up her lunch tray, the one she'd left there 10 minutes ago, salad with olive oil dressing, black coffee, and apple she'd sliced into quarters. He didn't say anything. He simply tilted it. The tray went horizontal. Salad cascaded onto the linoleum floor. The coffee cup shattered, sending a dark stain spreading across the white ceramic pieces like blood pooling. The apple quarters scattered across the spill. Margaret watched it happen the way she might watch a car accident through a hospital window, present, observant, separated by glass. "Oops," Caldwell said. Then he pulled Jake Mitchell's chart from under his arm. The boy's entire medical record. The thick blue folder that contained every note, every test result, every observation Margaret had made over the past 2 months. Caldwell held it for exactly 1 second, long enough for her to see his name at the top in her handwriting. Then he opened his hand. The chart fell. Papers scattered like autumn leaves across the spilled coffee and broken ceramic. Some stuck to the wet floor. Others slid under the refrigerator. One page landed on her shoe. "Pick that up, sweetheart," Caldwell said, his voice pitched low enough that only the people in the immediate radius could hear him. "And stick to bed baths. That's what nurses do. Doctors make the decisions. Medical decisions. Real ones. Not fairy tales." He smiled at the residents. "Anyone who needs coffee, it's going to take her a minute." He walked back out of the break room without waiting for a response. The silence that followed was the kind that fills a room like water. One of the residents opened his mouth. Closed it. The respiratory therapist found something very interesting to read on his phone. The youngest nurse, couldn't have been more than 4 years into her career, looked at Margaret's face and then looked away, embarrassed on her behalf. Margaret kneeled down. Her hands were perfectly steady as she began gathering the scattered pages. The wet ones she handled with extra care, separating them gently so the ink wouldn't smudge further. The dry ones she stacked into a neat pile. She used a paper towel to wipe the apple slices from the floor. They'd already absorbed the coffee, saturated, no longer edible. Her jaw was clenched so tightly she could feel the muscle working at the back of her neck, but her face was smooth. Blank. A woman doing a simple task. She found a plastic bag under the sink. Deposited the broken ceramic, the soggy salad, the ruined apple. She worked methodically. Kneeling for 5 full minutes, gathering every scattered page of Jake Mitchell's chart, reading each one briefly to confirm she had them all, stacking them back into the blue folder. Her knees didn't shake. Her hands didn't waver. She stood, wiped the floor with fresh paper towels, and discarded those as well. "Thank you for the feedback, doctor," she said to no one in particular, her voice smooth as still water. Not sarcastic. Not bitter. Just stated as fact. She held Jake's chart against her chest and walked to the nurse's station to file it properly in the secure cabinet, each movement economical, practiced, the kind of movement that comes from having done things under pressure where hesitation meant death. One of the residents watched her walk away. His name was Chen. He was the only one who'd shown Jake's parents any actual kindness during rounds. He was also young enough that he still believed the system rewarded competence and ethics. He was staring at the spot where Margaret had been kneeling, his face a shade of red that suggested he was having several thoughts he didn't know how to voice. She didn't look back. 10 minutes later, Margaret found herself in the supply closet inventorying for kits. It was for 17 p.m. Her shift ended at 7. She had pulled the door shut behind her, not locked, just closed, and let her hands find the metal shelf in front of her. Cool under her fingertips. Industrial. Real. Her hands began to tremble. It wasn't rage. Rage would have been cleaner, would have burned through her system like jet fuel, leaving her hollow and functional. This was something else. This was the tremor that comes from holding absolute control for 30 seconds too long. Her fingers curled around the shelf edge like she was gripping a cockpit stick during a carrier landing, and her whole body shook with the effort of not slamming her fist through the plywood. She breathed. In through her nose. Out through her mouth. The Navy way. The way they'd taught her in BUD-SES when the pain got so loud you couldn't hear the instructors screaming. The way she'd learned it again in Bagram when shrapnel was still lodged in her left shoulder and they needed her on the surgical deck anyway. Her hand steadied. 30 seconds. That was all it took. By 4:18 p.m., the trembling had stopped. Her fingers were still white where they gripped the shelf, but the shake was gone. She released her grip and let her hands hang at her sides, checking them like a pilot checking instruments. Steady. Ready. No visible signs that anything had broken inside her. She finished the inventory, returned to the floor, and continued her rounds as if nothing had happened. But that night, at 10:27 p.m., sitting in her car in the hospital parking lot with the interior light off, Margaret opened her encrypted laptop and pulled up Jake Mitchell's case file. Her hands moved through the data with the same mechanical precision she'd used to gather the scattered chart pages. Blood work. Imaging. Vitals. She cross-referenced the symptoms against a private medical database she accessed through a VPN routed through 3 countries. Elevated cardiac enzyme markers on yesterday's labs. Slightly elevated troponin. His EKG showed subtle T-wave changes in the lateral leads. Pericardial effusion. Fluid building up around the heart. The kind of thing that took days to develop, the kind of thing that a competent cardiologist would catch immediately, the kind of thing a pediatric neurologist would note and then dismiss as statistically irrelevant, which is what Caldwell had written in his afternoon note. Margaret pulled up that exact entry, mild pericardial fluid noted on echo. Likely post-traumatic, self-limited. Continue monitoring. No intervention indicated at this time. No intervention indicated. She ran the numbers. Jake's current vital signs. His fluid balance. The rate at which pericardial fluid accumulated in pediatric trauma patients. The timeline stretched out in front of her like a runway with a dead end. 48 hours. Maybe 60 if his heart was strong enough. After that, the fluid pressure would rise enough to compress the chambers, restrict filling, drop his cardiac output. The medical term was cardiac tamponade. The outcome was acute heart failure. The body failing while the mind was trapped inside, fully aware. Margaret photographed Caldwell's dismissive note with her phone camera. The timestamp. The exact phrasing. Then she encrypted the image and typed a message to her NCIS handler using an open-source messaging app that deleted everything after 48 hours, pediatric patient deteriorating. Attending physician dismissing signs of cardiac complication. Child has approximately 48 hours before catastrophic decompensation. Current directive is to maintain cover and observe. If observation protocol requires a 7-year-old to die, I need clarification on rules of engagement before that becomes an active situation. She sent it at 11:34 p.m. The response didn't come until 5:17 a.m. Margaret was sitting in her car in the hospital parking lot, waiting for the sun to rise, waiting for shift change, waiting for anything to move. The message appeared on her phone in cold, professional typeface: maintain cover. Do not compromise investigation. Patient has attending physician. Not your liability. She read it 3 times. Not your liability. She deleted the message, then cleared the entire conversation thread. Her hands were perfectly steady as she did it. She was good at compartmentalizing. It was a survival skill, not a character flaw. Keep the mission separate from the emotion. Keep the objective clear. Don't contaminate either with the other. But Jake Mitchell's chart was sitting on her passenger seat, the pages she'd gathered from the coffee-soaked floor still slightly damp, still slightly stained with Caldwell's contempt. She picked it up and reviewed his admission photo, the boy's face calm before the accident, before the paralysis, before he understood that his body had betrayed him. She put the chart back down. Then she started her car and drove to her apartment, where she showered, changed into fresh scrubs, and returned to the hospital for shift change. The parking lot was already crowded with the morning crew arriving to relieve the night shift. Everything was normal. Everything was proceeding according to protocol. Protocol understood. Writing segment 3 of 5 as one continuous flowing narrative for no doctor would help the Army Ranger captain's paralyzed son. One nurse did. Margaret's true identity had been classified for 14 months before St. Michael's. Naval Criminal Investigative Service had embedded her because someone was stealing medical supplies, specifically high-grade cardiac monitoring equipment, surgical-grade antibiotics, and trauma dressings worth approximately $847,000 over the past 18 months. The theft was surgical. Precise. Someone with access credentials and knowledge of hospital inventory systems was moving inventory through a gap in the audit cycle. NCIS suspected insider involvement, possibly someone with administrative access or someone who had cultivated relationships with warehouse staff. Margaret had arrived 3 months ago with a completely fabricated nursing resume, a social security number that traced back to a genuine Maryland nursing school that had closed in 2009, and a personnel file constructed specifically to withstand casual background checks but collapse under serious scrutiny. The operation was meant to last 6 months. Identify the theft ring. Document the perpetrators. Extract. Move to the next investigation. She'd done this 7 times before, different hospitals, different cities, different lies. But this time, she'd met a 7-year-old boy whose spine had been severed by a vehicle she could have prevented if she'd been there. And she'd met his father, who didn't recognize the combat nurse who'd kept him alive in Helmand Province because that version of her had been covered in someone else's blood and wore a rank insignia that officially no longer existed. Now Caldwell knew something was wrong with her. Not what? Not yet. But something. The first call came at 7:56 a.m. on a Wednesday. Margaret was restocking the pediatric floor supply cart when Caldwell's administrative assistant, a nervous woman named Patricia, appeared with a message: Dr. Caldwell needs the hospital board chairman to review your personnel file. Routine credential verification. The words were clinical. The delivery was execution. Margaret's jaw moved once, a single micro-clench, and then she continued counting morphine milliliters as if the words had never arrived. She had maybe 18 hours. 2 if she was lucky. By 10:33 a.m., the hospital attorney's office had called the nursing school. Margaret knew this because the nursing school no longer existed to answer, but the phone number connected to a NCIS administrative office in Arlington, Virginia, which would eventually respond to inquiries in a way that looked legitimate but included deliberate inconsistencies. By 11:15 a.m., the attorney's office had called her listed previous employer, a hospice care facility in Tucson that closed down in 2014. By noon, they were trying to reach 3 other facilities, and the gaps in her employment history began to look less like job hopping and more like fabrication. Caldwell sat in the hospital board chairman's office that same afternoon. Margaret didn't witness this. But she knew it happened because Caldwell had been dismissed from rounds at 1:44 p.m., and the chairman's administrative assistant had called down asking for all materials related to Margaret Walsh's recent clinical suggestions and protocols. The language was corporate. The intent was destruction. What Caldwell didn't know was that Margaret had a secure phone buried beneath 3 layers of hospital linens in the pediatric supply closet. What he didn't know was that she'd intercepted the page meant for the nursing supervisor. What he absolutely could not have known was that her handler at NCIS had sent an encrypted message: inquiries exceed normal parameters, recommend extraction protocol within 12 hours, which Margaret had read and then deleted, her hand steady as surgical steel even though she could taste copper in her mouth. Jake Mitchell was dying. Not dramatically. Not in a way anyone else would notice. But Margaret had spent 23 years reading the subtle language of bodies, and Jake's body was speaking fluently. His blood pressure had dropped from 104/68 to 98/60 in 48 hours. His heart rate climbed from 88 to 106 to 118. His oxygen saturation held at 96% only because the staff was careful, because Margaret had positioned him slightly elevated, because she'd adjusted the nasal cannula 3 times to optimize the flow without anyone asking why. The pericardial effusion, the fluid compressing his heart, was accumulating exactly as predicted. The echocardiogram from day 1 had shown 2.4 centimeters of fluid around the heart. Margaret had mentally calculated the rate of accumulation based on the child's respiratory pattern, his medications, the output from his urinary catheter. Simple fluid balance. Basic pathophysiology. The kind of math that got soldiers killed if you were off by even 2 millimeters. At 6:11 p.m., Captain Ryan Mitchell sat in the corner of Jake's room in a vinyl chair that smelled like bleach and human despair. His paralyzed son slept fitfully between them, and Margaret moved through the room like a ghost made of muscle memory. She checked the monitor. She adjusted the 4 fluids, not because orders changed, but because a single mom pushing 1,000 milliliters per hour was going to increase cardiac preload, which would accelerate the fluid accumulation. She documented vitals every 60 minutes in a nursing note that read clinical and unremarkable and was actually a detailed timeline of a child's deteriorating cardiac function written in medical shorthand. At 8:34 p.m., she brought her concerns to the night shift attending, a good doctor named Chen, earnest and careful. Margaret kept her voice level. Jake's heart rate is trending up. BP trending down. I'm seeing what looks like early signs of cardiac compromise. I'd like to call Dr. Caldwell and discuss whether we should consider. I'll check his orders. Dr. Chen's voice was kind. Exhausted. He pulled up the chart and his expression changed, not much, just a tightening at the corners. Caldwell's orders are explicit. Monitor only. No invasive procedures without direct attending authorization. He was very clear about this during rounds. Can you call him? It's 8:40 at night. And Margaret, Chen's voice dropped. Caldwell told me specifically not to authorize any additional testing or procedures that you recommend. He said you've been presenting ideas beyond your scope of practice. Hospital legal is reviewing your credentials. The room didn't spin. Margaret's vision didn't blur. Her hands didn't shake. She breathed in through her nose and out through her mouth, which was a technique taught at every combat trauma training pipeline in the military, tactical breathing. 4-4-4-4, 4 counts in. Hold 4. Out 4. Hold 4. You don't react to information that will kill you. You process it. You adapt. You survive. Understood, Margaret said. The word came out flat and even. Thank you for checking. She stood at Jake's bedside for the next 4 hours. Ryan slept in the vinyl chair, his head tilted back at an angle that would hurt in the morning. Jake's oxygen saturation held at 96% through pure monitoring discipline. His heart rate climbed to 124. His blood pressure fell to 94/58. Margaret calculated the time remaining with the same precision she'd used to estimate blood loss in a hot zone 8 years ago. Current effusion rate times cardiac output minus pericardial compliance equals approximately 6 hours until tamponade. Maybe 7 if he was lucky. maybe 5 if his fluid retention accelerated. At 11:16 p.m., her encrypted phone buzzed. She didn't answer it. She turned the phone completely off and walked to the pediatric supply closet, a space 8 feet by 12 feet with metal shelving and the faint smell of iodine and latex. She began to assemble supplies with the methodical precision of someone who had done this on a concrete floor in 140-degree heat, who had done it while rounds were landing a quarter-mile away, who had done it while holding a tourniquet in one hand and a suction tube in the other. Ultrasound machine. The portable unit from the crash cart, not the big one, easier to conceal, small enough to fit under a mobile supply cart. Needle. A 22-gauge spinal needle would work. It was designed for CSF drainage, which meant it was long enough to reach the pericardial space and small enough to minimize risk of coronary artery laceration. Sterile field. Gloves. Chlorhexidine for skin prep. A drainage kit usually reserved for thoracentesis, which was technically overkill for a pericardiocentesis but gave her options if she needed to establish a catheter. Sterile gauze. Tape. A 50 milliliter syringe because she estimated the accumulated fluid at 200 ccs, maybe 240 if she was being conservative. She placed everything in a supply cart, positioning supplies so the equipment below was covered by routine hospital items, dressing packages, for flush syringes, the normal clutter of pediatric care. From above, it looked like she was restocking. Below, it was an operating room disguised as inventory management. The hospital was quiet at midnight. Not silent. Hospital quiet is different, a muted roar underneath silence, ventilators breathing, monitors beeping in distant rooms, ice machines humming, fluorescent lights buzzing their constant electric prayer. Margaret pushed the supply cart toward the pediatric wing and didn't allow herself to think about the NCIS handler waiting for her to follow extraction protocol. Didn't allow herself to calculate the professional consequences of compromising an 18-month investigation. Didn't allow herself to consider what would happen when this was over and her face was on the news and her family in Montauk had to explain to neighbors why their daughter was classified for a decade. She pushed the cart into Jake's room at 12:04 a.m. Ryan was still asleep. Jake was restless, his small body fighting something only he could feel. Margaret closed the door quietly and checked the monitor one final time. His heart rate was 138. His blood pressure was 91/54. His oxygen saturation had dropped to 93% despite the nasal cannula. The pericardial fluid was going to arrest his heart sometime between 4 and 7 a.m. if she did nothing. She had never, in her entire career, had trouble making the choice between a mission and a child's life. That wasn't professional. That was human. The monitor screamed at 3:27 a.m. Blood pressure 72/40. Heart rate 163 and climbing. Oxygen saturation dropping like a stone through deep water. Jake Mitchell's small chest heaved against the ventilator, the mechanical breath fighting something the machines couldn't see. Margaret was there before the night resident finished processing what was happening. She'd been 3 rooms down, checking post-op vitals. She heard the cascade of alarms and moved. The boy's pericardium, the sac surrounding his heart, was filling with blood. 200 cubic centimeters of it. Maybe more. His heart couldn't pump what it couldn't expand to hold. Cardiac tamponade. Not statistically irrelevant anymore. Actively lethal, right now, in the next 4 minutes. Margaret's hands didn't shake. She hit the code button with her knuckle, then turned to the supply cabinet. 14-gauge angiocath needle. Ultrasound probe. Betadine. Sterile field. Her movements were fluid, economical, each action flowing into the next like water finding the lowest point. The night resident, a young man named Torres, burst through the door. "What's happening?" "I'll call the attending." "His pericardium's full of blood," Margaret said. She was already positioning the ultrasound probe on Jake's chest, finding the fluid collection with the kind of precision that comes from having done this before. Intense. In darkness. While mortars walked across a forward operating base. "Call Caldwell if you want. Hand me that drainage syringe." Torres stared. You can't, that's an invasive procedure, you're not authorized. Then call him. Margaret prepped the insertion site with betadine in concentric circles, the amber liquid darkening the thin skin below the xiphoid process. She advanced the needle at a 45-degree angle, watching the ultrasound screen, feeling the subtle give of tissue surrendering to the sharp tip. Or hand me the syringe and let me save his life. Choose now. Torres handed her the syringe. The needle slid into the fluid collection. Dark blood, almost black, filled the chamber. 50 cc. 100. The numbers climbed as Jake's blood pressure began its climb back toward normal. 150 cc. The heart rate dropped from 163 to 140. Oxygen saturation ticked upward. 150 cc. 175. 200. Margaret withdrew the needle and applied direct pressure with sterile gauze. The boy's heart was breathing again. The ventilator's rhythm synchronized with his own body's effort. Blood pressure 123/81. Oxygen sat 93%. Sinus rhythm. She'd extracted exactly 200 cc of blood from the pericardial space, the kind of precision that separates competence from mastery. The code team arrived 6 minutes later to find Jake stable. The boy's color was pink. His pupils reactive. His mother's warrior, 3 months old and still unnamed, was breathing on his own through the tube, no longer drowning in his own blood. Margaret documented everything with the clinical precision of someone who understood that paperwork is a form of truth-telling. Time, 3:13 a.m. Emergency pericardiocentesis performed. Volume withdrawn, 200 cubic centimeters, vital signs post-procedure. She signed her name and stepped back, her uniform perfectly pressed despite the crisis that had just unfolded, her hair still tied back in the regulation military bun even though no one here knew that regulation had come from the Navy, not a nursing school. Torres stared at her. "Who are you?" She didn't answer. Dr. Caldwell arrived at 4:10 a.m. in golf clothes, polo shirt with a club logo, khaki shorts, white shoes. He'd been called from his house. His face went through 3 colors as he read the chart, first red, then white, then a kind of calculating gray. He looked at Margaret with the expression of a man watching his foundation crack. "You performed an unauthorized invasive procedure," he said, voice flat. "Without physician oversight. You've violated every protocol in this hospital." Margaret's face showed nothing. Her voice came out steady, measured, the voice of someone stating facts to someone who should already understand them. The alternative was watching him die. You dismissed the fluid accumulation as statistically irrelevant. It wasn't. It was actively compressing his heart. Caldwell's jaw worked. He pulled out his phone, the gesture aggressive, a predator that had just realized the prey had teeth. He dialed the hospital board chairman directly. The tremor in his voice was barely concealed. "We have a liability issue. Immediate suspension required. Unlicensed practitioner performing procedures beyond scope. Call you back." He hung up. Looked at her. "You're done here." By 7:16 a.m., Margaret sat in the nursing supervisor's office. By 9:02 a.m., hospital legal was on the phone with a problem. Her background verification had flagged inconsistencies. Red flags everywhere. Addresses that didn't match. Employment records that verified through channels that no longer existed. A nursing school diploma from an institution the hospital couldn't reach. "We can't confirm your credentials through standard channels," the attorney said, voice careful. "That makes you a significant liability. We can't defend someone we can't verify. Suspended pending investigation." That afternoon, Margaret returned to the locker room during shift change. The other nurses watched in silence, a kind of collective understanding moving through them wordlessly. She opened her locker and began emptying it. The stethoscope. The penlight. The trauma shears with her initials scratched into the handle. Her spare shoes. Everything went into a small bag. Then she reached down to the bottom of the locker, where she'd kept them hidden beneath the spare uniforms, and pulled out the combat boots. The leather was cracked with age and repeated repairs. The laces were still knotted the way they'd been in Bagram, back when she'd tied them before the convoy rolled out. Worn soles. Scuffs from concrete bunkers. One heel had a dark stain that was probably 8 years old now, probably blood, probably Captain Ryan Mitchell's. She folded her scrubs with military precision, each crease exact, corners aligned at 90-degree angles. The white fabric became a small rectangle, then she placed it in the hospital laundry cart. Beside it, she set the combat boots. Not hidden anymore. Visible. The only proof of who she really was. The only thing that would destroy the NCIS investigation into the medical supply theft ring operating inside St. Michael's, the case she'd been undercover to build for 4 months. 3 months of invisibility. 3 months of pretending to be nobody while watching everything. 3 months of evidence gathering, supply chain documentation, the slow accumulation of proof that would expose the network of hospital employees selling expensive surgical equipment on the black market. Gone. Because she'd chosen a 7-year-old boy over an investigation. She closed the empty locker and walked out through the emergency department, past nurses who'd worked beside her without seeing her, past the trauma bay where she'd stabilized a gunshot victim 2 weeks ago, past the supply closet where she kept her service weapon locked in a safe behind the 4 bags. The rain hit the parking lot like applause. 3 days later. Ryan Mitchell stood in the main lobby of St. Michael's Hospital, asking questions no one would answer. Where did Margaret Walsh work? Could they forward a message? She'd saved his son's life and then vanished. The hospital wouldn't confirm she'd even existed. We can't release employee information, the receptionist said, voice apologetic but final. He was about to leave when the security guard, a weathered man in his 60s with a Marine Corps tattoo visible on his forearm, approached. The man had been standing near the information desk, and something in his bearing suggested he understood what Ryan was actually asking beneath the surface questions. They'd started talking, the easy conversation of people who recognized the shape of service in each other's posture. That was when the television cut to breaking news. The CNN banner was stark, breaking news, missing Navy Master Chief sought for questioning. Margaret's official military portrait filled the screen. Dress whites. Chest covered in ribbons arranged in the ascending order of combat decorations. Master Chief Petty Officer insignia. The anchor's voice was urgent, the kind of urgency that usually meant a missing person had shifted from disappearance to emergency. Decorated combat medic, Navy Expeditionary Medical Support Unit, deployed to forward operating base Bagram, Logar Province, Afghanistan, where she saved 17 lives during a sustained Taliban assault in October 2016. Master Chief Margaret Walsh was recruited for months ago for a classified NCIS investigation and disappeared from her assigned location in San Antonio. Her family is asking for any information regarding her whereabouts. The Department of Defense is offering her. The security guard set down his coffee. He stood. Pulled his shoulders back with the kind of movement that's muscle memory at 70, still ingrained despite 20 years since the last deployment. His voice carried through the marble lobby with the weight of military command, Master Chief on deck. 20 people froze. A janitor in the corner, Army combat patch visible on his jacket, immediately straightened, eyes forward. His voice echoed the ritual, Master Chief on deck. Then a visitor in a wheelchair. Then a volunteer at the information desk. The lobby became a gathering of people responding to something ancient, something that transcended current location or uniform. Ryan Mitchell felt the words move through him like electricity. He stepped forward, voice shaking, and repeated a call sign he'd carried for 8 years without speaking it aloud, Master Chief Margaret Walsh. Call sign Ironside. The lobby went absolutely silent. 40 people. No one moving. The television continued its urgent narration, but no one was listening anymore. Ryan reached into his jacket. His hands were steady, everything Margaret had taught him about pressure and focus and refusing to let fear control your body. He pulled out a flag, the one presented to him at his retirement ceremony, the one folded into the precise triangle that comes from military hands that have done it 1,000 times. "Bagram," he said. October 2016. Forward Operating Base. My unit was running convoy to the northern sector when we hit an IED in the Jolan district. My vehicle took the blast directly. My femoral artery was severed. I was bleeding out in 90 seconds. His voice didn't crack. This was a mission report, not a story. Facts. Data. Truth. She was at the aid station 3 kilometers away. Heard the call sign over the radio and ran toward the incoming helicopter instead of away from it. Found me bleeding onto the concrete. Clamped my femoral artery with her bare hands, no tourniquet, no clamp, just her hands and pressure, and someone who understood that some people don't get to die today. Someone in the crowd was crying. Took 3 pieces of shrapnel while keeping her body between me and the mortar rounds walking across the base. Held pressure for 17 minutes while the medevac couldn't land. Never filed for the Purple Heart. Never told anyone. Just disappeared when the deployment ended like she'd never been there at all. Ryan unfolded the flag slowly, reverently, the way you handle something sacred. She gave me 6 more years with my son. She took the shrapnel meant for me and never told a soul. And 3 nights ago, when this hospital was ready to let my 7-year-old boy die from fluid compressing his heart, she saved him again. Performed a procedure she wasn't authorized to perform. Violated every protocol they have. Then they suspended her for it. The hospital board chairman stood frozen at the elevator bank, face draining of color as he processed what this meant, what this exposed, what the news cameras waiting outside were about to film. Dr. Caldwell emerged from the coffee shop, cup still in his hand, seeing the screen, seeing Ryan, seeing the crowd, seeing the security guard and the janitor standing at the exits with their shoulders back and their faces set. His mouth opened but nothing came out. Ryan turned to face him directly. She risked her entire mission, her cover, her investigation, her career, to save my son when you'd written him off as statistically irrelevant. And you threw his chart at her feet. The room didn't move. No one needed to. The security guard positioned himself between Caldwell and the nearest exit. The army janitor moved to the door. No one had said a word, but Caldwell was suddenly surrounded by the physical reality of accountability. The board chairman found his voice, Dr. Caldwell. My office. Immediately. 3 days. That's all it took for the world to find out who Margaret Walsh really was. The CNN alert hit at 2:14 p.m. on a Tuesday. The hospital lobby had a wall-mounted television above the reception desk, the kind nobody pays attention to until something catastrophic happens. A woman waiting for lab results was the first to see it. Then a visitor. Then 3 more. Within 90 seconds, 15 people stood facing that screen, watching a breaking news banner scroll across the bottom of the frame, missing Navy officer located, whistleblower in major medical investigation. The anchor's voice carried weight, the kind that comes only with genuinely shocking news. Navy Master Chief Petty Officer Margaret Walsh was reported missing 3 months ago following a classified Pentagon investigation. Today, she's been identified as the whistleblower behind a federal corruption case at St. Michael's Hospital in San Antonio, uncovering a medical supply theft ring operating inside the facility. Master Chief Walsh, who saved 17 lives during combat operations in Bagram in 2017, was working undercover as a registered nurse. The screen filled with an official Navy portrait. Margaret in dress whites, shoulders back, eyes forward, the kind of photograph that carries the weight of rank and service the way sunlight carries heat. No softness. No hesitation. Just a Master Chief Petty Officer of the United States Navy looking directly at the camera as if she could see straight through it. Ryan Mitchell was standing in that lobby. He'd come to watch Jake's progress in physical therapy. His son had moved from wheelchair to parallel bars, taking 4 steps yesterday, 5 the day before. Ryan still didn't know the details. The hospital had been silent about Margaret's suspension, just told him she was unavailable, a new physical therapist would take over. That had been 3 days ago. He'd assumed she'd quit. He'd assumed she got tired of fighting Caldwell. He watched the portrait fill the screen. Watched the anchor talk about classified investigations. Watched other patients and visitors turn to look at each other, then back at the TV. The security guard was a Marine, 34 years old, name tag that read Holloway, the kind of straight posture that comes from 8 years active duty and never quite leaving it behind. He'd worked at St. Michael's for 2 years. He recognized authority the way other men recognize their own reflection. When the portrait stayed on screen for a full 10 seconds, Holloway's spine straightened. His shoulders came back. His hand moved to his chest in a gesture that was automatic as breathing, not quite a salute, not quite a placement of the hand over the heart, but something that existed in the space between civilian life and military bearing. He turned to face the lobby, and his voice carried the kind of resonance that made fluorescent light seem to dim. "Master Chief on deck." The room went silent. 15 strangers and a Marine guard, all turning to look at the door, at the elevator, at the corridor where such a person would emerge if she were here. The lobby held its breath. Ryan stepped forward. He moved like he was walking through water, each step deliberate. His hand shook as he pulled a folded piece of cloth from his jacket, not a flag, not exactly, but a flag that had been folded military style, creased sharp enough to cut, held in both hands the way you hold something sacred. "I'm Captain Ryan Mitchell," he said. His voice cracked and he didn't try to hide it. 3rd Battalion, 5th Marines. Dark Horse Company. This is the flag from my daughter's birth ceremony. She's 8 now. And I have a son named Jake, 7 years old, who 3 days ago was told he'd never walk again. Who had cardiac fluid compressing his heart and no doctor would listen to the nurse who knew what to do. His eyes found Holloway, then the receptionist, then every other face in that lobby. Master Chief Margaret Walsh gave me 6 more years with my son. In Bagram, 2017, she took the shrapnel meant for me and never told a single soul. I didn't even know until her commander explained it 3 years later. And yesterday, she saved my boy's life by doing what her conscience demanded, against orders, against protocol, against a doctor who was wrong. Ryan unfolded the flag deliberately. True heroism is what you do when the world stops watching. But today, I'm watching. And I'm not the only one. He held the flag out toward the television, where Margaret's portrait still filled the screen, and someone in that lobby, a woman with a phone, probably recording a TikTok video for her sister, captured the moment. The image of Captain Ryan Mitchell standing in a hospital lobby with his daughter's ceremonial flag, tears streaming, speaking into the silence about a woman he barely knew but owed everything. That video existed on 17 platforms before the hospital's communication department even knew it was being filmed. By 6 p.m., it had 6 million views. By midnight, 12 million. The hashtag #MasterChiefWalsh trended on 3 continents. News outlets scrambled to find the original CNN source and discovered that NCIS had leaked the information deliberately. They'd timed the public disclosure to coincide with 4 federal arrests related to the supply theft ring, and they wanted St. Michael's accountability to be inescapable. Dr. James Caldwell was in his office when the video went viral. His office was on the 3rd floor, corner position, with a view of the city that had seemed like status until about 3 hours ago, when his phone started ringing. His mentor. His former partners. His brother-in-law. His country club. By the time the Johns Hopkins statement arrived, delivered by email at 7:11 p.m., Caldwell had already received 43 calls and deleted 32 of them. Dr. Raymond Caldwell Sr., the man who'd sponsored James's career, the surgeon whose recommendation had opened every institutional door, the voice that had shaped his entire professional identity, had released a public statement. It ran on MSNBC, CNN, Fox News, and every medical newsletter by morning. I am horrified and ashamed to learn of the conduct displayed by Dr. James Caldwell, my former student. His treatment of a decorated combat veteran and his dismissal of sound medical judgment represent everything I fought against in my 40 years of practice. I disavow his actions completely and have contacted St. Michael's board to offer my full support for his immediate removal. He is the most disappointing student I have ever trained. The most disappointing student he had ever trained. Not the worst. Not the least prepared. The most disappointing. As if James had possessed potential and squandered it. As if he'd been given tools and chosen weapons instead. The statement ran on a loop, and with each iteration, the weight of it pressed deeper. The hospital board convened an emergency session at 8 a.m. the following morning. They reviewed the resident's testimony about the $50 bet. They watched security footage of Caldwell knocking the lunch tray to the floor, watched him throw Jake's chart at Margaret's feet. They read the emergency room notes showing that Jake Mitchell's cardiac tamponade would have been fatal within 8 hours of Caldwell's dismissal of Margaret's assessment. They calculated liability. They calculated lawsuit damages. They calculated the PR cost of keeping a surgeon on staff who'd nearly murdered a child to prove a point. What happened next happened in stages, each one meticulously documented. At 10:15 a.m., the board voted unanimously to terminate Caldwell's employment. At 11:16 a.m., the state medical board received notification and opened an investigation. At 1 p.m., Johns Hopkins launched its own review of Caldwell's training record. By 4:51 p.m., 3 consulting positions at other institutions had been terminated. The most damaging discovery came from NCIS. In Margaret's 3 months undercover, she documented every instance of Caldwell accessing pharmaceutical inventory without proper authorization, every surgical supply requisition that didn't match patient records. His name appeared 17 times in the investigation file. He wasn't part of the theft ring, but he'd been loose with access codes. He'd been careless. He'd been the kind of administrator who thought the rules didn't apply to him because he was important. Within a week, James Caldwell ceased to exist as anyone meaningful. The hospital's legal team sent a termination letter that outlined cause for immediate removal. His medical licenses went under review in Texas, California, and New York. 2 pending publications were pulled by peer review. Conference invitations evaporated. The consulting positions disappeared. Former colleagues changed their phone numbers. His ex-wife, who'd been thinking about remarrying him, took his calls off her list. 6 months later, James Caldwell stood in a basement classroom at San Antonio Community College, teaching CPR certification to a group of teenagers who didn't know his name. The room smelled like industrial cleaner and rubber mannequin. The fluorescent lights buzzed with the kind of persistent, low-level irritation that becomes background noise after the first hour. He'd been hired for $18 per hour. No benefits package. No research budget. No team of residents to manage. Just him, a CPR dummy, and teenagers scrolling on their phones. One afternoon, a woman came into the parking lot wearing St. Michael's badge. Former colleague. She pretended not to see him. He watched her get into a car and drive away without looking back. The boot stayed on the wall of the St. Michael's physical therapy room. In a shadowbox frame, polished leather restored and preserved like relics. The plaque read, Master Chief Margaret Walsh, USN. Bagram 2017. 17 saved. 0 quit. 6 months after the lobby revelation, Margaret Walsh knelt beside Jake Mitchell's wheelchair, watching him balance between parallel bars. The boy's legs trembled with effort, muscles weak from months of paralysis, now retraining, rebooting, learning again how to hold a human body upright against gravity's pull. Morning light streamed through tall windows. The physical therapy room was quiet except for the squeaking of the bars as Jake shifted his weight, the soft brush of fabric as Margaret adjusted the brace on his left leg, checking alignment. That's 7 steps, she said. Yesterday was 6. Tomorrow will be 8. The boy grinned through the effort. Sweat on his forehead. Determination written in the set of his jaw. He had his father's face, that same capacity for pushing through pain without complaint. Margaret's hands hovered near his waist, ready to catch him if he fell, but she didn't help. Didn't steady him. Didn't do the work for him. That was the entire point. Ryan Mitchell stood 6 feet away, watching his son walk. He was crying openly, not bothering to hide it anymore. 3 times a week he came to these sessions, and 3 times a week he cried watching his son's body remember how to function. His dress uniform hung in the back of his closet. His next deployment was scheduled for October. But Jake would be running by then. Jake would be fine. Margaret helped the boy back into his wheelchair. Jake was exhausted, hands trembling with the kind of good fatigue that comes from pushing past what you thought possible. She made notes in his chart: 7 steps, balance holding, no signs of dizziness, range of motion improving in left knee. Ryan approached, extended his hand formally. Master Chief. She shook it. Captain. They stood like that for a moment, 2 people who'd seen the worst and chosen to save what they could anyway. The wordless understanding of soldiers and healers who know that sacrifice sometimes means losing everything you thought you were so you can become something true. Why didn't you tell me? Ryan asked finally. When Jake was admitted. You knew who I was. Why not say something? Margaret considered this. The question that had probably been waiting for 6 months, patient as a loaded weapon. Because what happened in Bagram was my job, she said. What happened here was also my job. Neither one needed recognition, they just needed doing. She stood, brushed off her knees, checked Jake's braces one more time. The work doesn't matter because people know about it. It matters because it's done. Ryan watched her, this woman who'd saved his life twice, saved his son's life, lost her career temporarily because she refused to let policy override conscience. What do you tell people, he asked, when they ask what heroism looks like? Margaret glanced at Jake, already asking his dad when they could come back tomorrow, planning for 8 steps, then 9. She thought about Caldwell teaching CPR in a basement classroom, about the residents who'd stayed silent until public pressure forced their voices, about the board chairman who'd enabled cruelty until shame made it impossible. She thought about 16 soldiers in Bagram. For arrests from the investigation. 1 7-year-old boy learning to walk again. True heroism, she said finally, is what you do when the world stops watching. She headed for the door, 12 more patients on her morning rounds, a profession that never stops needing people who understand that some things matter more than titles or recognition or the comfortable safety of silence. She had Jake on the schedule again tomorrow. And the day after that. As many days as it took. If you made it this far, you know what real courage looks like. It's not always loud. Sometimes it's the person in the corner, carrying secrets, doing the work nobody will ever see. If this story moved you, if you saw yourself in Margaret's refusal to quit, in Ryan's willingness to speak truth even when his voice shook, subscribe now. Like this video. Comment about a time you did the right thing when it cost you everything. Because heroes walk among us every single day. And someone needs to tell their story.